Hey guys, welcome to another episode of the Dr. Akash Show. Now today, super hot topic, been getting more and more attention, which frankly I think is overdue and very important and necessary. We're going to talk about testosterone. We're going to break down testosterone, what it does, how you can replace it if that seems right for you, other alternatives if you're not interested in replacement at this point, other pitfalls to watch out for with testosterone. And we're going to just break it all down and keep it nice and practical with information that you can use. But real quick, if you find this valuable, please like, share, and subscribe this content. This is a new platform, a new podcast. And so by liking and subscribing to this, you're teaching the algorithms to show this to more like-minded people like us. So please like, subscribe, and share. It means a lot to us as we get off the ground and started here. All right, so let's talk about testosterone. So testosterone is very near and dear to many people that I know, many clients that I've treated. This has been a game changer, myself being client number one. So personally, I noticed as I was working harder and harder, as I had more on my plate, no matter how hard I try to just will through things and power through things, I noticed myself noticed myself having less energy than normal. I noticed myself being more and more procrastinating with things that I needed to get done. And this just led to bigger problems, right? Because that lack of energy, or more importantly, that lack of ambition and desire to really do things, it was really difficult. It's kind of a mind fuck a little bit, right? Because if you think about it, like most of us, we probably have a list of things that we want to do, but if you're not physically or mentally able to actually get those things done, you have this whole kind of ongoing things to do list in your mind and you're not doing any of it. So you're just kind of teaching yourself that you don't do what you tell yourself you're going to do, and you're eroding your self-confidence and self-esteem little by little, day by day over time, to the point where at the end of a 6 or 12 month time period, you don't even recognize who you are. And frankly, you may not even respect who you've become. So for me and many of my clients, one of the key factors was just a dip in testosterone. I'm in my late 40s, and as we start to approach, even mid 30s nowadays and up, testosterone levels begin to decrease so significantly that it can completely alter who you are as a man and who you are as a human being. Today's world is a world filled with so many distractions, so many life stressors, so many things on our plate, from personal issues to professional issues, things like social media just compounding the problem. We are under so much stress today that the general testosterone levels for men today in any age, when compared with the same age male back in the 50s, is significantly low. And we're seeing a general trend of testosterone levels in males decreasing at all age groups, in addition to the natural degradation and decline of testosterone levels that we see as we age. We typically lose anywhere from 8.8 to 1% of testosterone levels every single year after about age 35 or so. Now, this problem is multifactorial, because not only does this contribute to decreased things that we know are associated with testosterone, like decreased libido and energy and things of that nature, but there's also links to other things that you may or may not realize are related to low testosterone. Things like decreased bone density, because testosterone is one of the hormones that promotes bone density in males. So if your testosterone is at a lower level than where it should be, you're at a greater risk of things like osteopenia and potentially osteoporosis down the road. Not a very talked about effect of testosterone, but incredibly important. Testosterone also has anti-inflammatory effects, which we'll talk about in a bit. So if your testosterone levels are not optimized, then your anti-inflammatory capabilities are also decreased. So you're much more prone to succumb to inflammatory-based disease processes. This could be things like degenerative disc disease, leading to sciatica, back pain, neck pain. This could also be things leading to inflammatory type disease states, like neurodegenerative inflammation, which basically means inflammation of your central nervous system, which may preclude you down the road to things like Alzheimer's and dementia and cognitive difficulties. So there's a whole host of reasons why optimizing your testosterone is incredibly important as an aging male. Listen, I faced this firsthand, and this is how I first got interested in this hormone, into this world of anti-aging and longevity. No matter how hard I try to push myself, when I hit about 35, 36, and I was starting my private practice and I was getting the ball rolling on that. You have to wear so many different hats as an entrepreneur and a solo business owner. I noticed that I wanted to do these things and I couldn't do these things. And I was just tired. I was winded and I had no motivation or ambition, despite myself telling myself I needed to do these things or wanted to do these things. In addition to that, guys, how many of you can relate to this? I had everything that I really wanted. I was living a life better than I thought I ever would have lived or better than I ever deserved. I had a financial target in my mind when I started my practice that I wanted to hit X amount of dollars per month, and I blew that target out of the water. So I had everything that I thought I wanted, but I just wasn't happy. I wasn't feeling super motivated, super excited. My mood was definitely more on the depressive side. And overall, that just affected everything in my life. It affected my relationships. It affected my ability to connect with my patients and connect with my staff. It affected my cognitive ability, my ability to think clearly so I could get out there and accomplish the things that I wanted to accomplish. It affected my physicality. No matter how much I worked out and tried to watch my diet, I always had a little bit of a dad bod or whatever you want to call it. And seeing that in the mirror, despite consistent work day after day, just slowly chipped away at my ability to do the things that I knew I needed to do and wanted to do. So eventually this led me to a path of, exploring myself. What's going on here? So I had my labs tested. My testosterone was in the toilet. There are two types of testosterone that you need to look at. And we'll talk more about this momentarily, but free testosterone and total testosterone, both levels for me were in the toilet. So I began to research ways to really optimize my testosterone. And once that process was completed, guys, this was like the blindfold coming off. Literally, like the blindfold coming off and your life going from black and white to full 4K color, high resolution video. Everything began to improve. Not only was I able to sleep better, leading to a much more productive day with a better mood, better cognition. I had greater libido, which improved my personal relationships. That increased sleep and increased ambition was back. So now when I'm waking up fully rested, my ambition is something that I actually have the energy and true motivation and desire to act upon. So I was able to act upon that. I was able, like I said earlier, I was able to think crystal clear so I could figure out the path that I wanted to take, and I was able to take it and execute on those decisions. In the gym and physicality wise, my workouts and my strict diet were now beginning to pay off. I was beginning to see the results that I thought I deserved and the results I thought I was working for. In addition to that, it was more motivating for me to continue to clean up my diet, continue to be more disciplined with my physical fitness and my physical routines. Everything compounded now in a much more positive way versus what it was doing before in just a totally detrimental way, circling the drain. So of course, because of the positive changes that I saw with testosterone, I want to get this message across to you. So if you're a male in your mid to late 30s and up, and you have some level of success, or you're a professional, or you're just really hustling and pushing hard to get yourself to where you need to go, but you find yourself feeling stuck in the mud, your physicality is not where it needs to be, your clarity is not what it used to be, your ambition isn't what it used to be, you're not happy like you feel like maybe you should be because you've checked all these boxes, this is something for you to really consider, guys. And it's so easy to determine where you're at with this by a simple lab test, a simple blood draw. So let's get into it. Some of the effects that you might notice with an optimization of your testosterone levels, and conversely, some of the things you might be dealing with now include libido being somewhat low, your muscle mass declining year after year, bone strength being a problem, leading like osteoporosis and osteopenia, your ability to burn fat and keep fat off being challenging, your mood overall just being kind of humdrum or maybe a bit blue or melancholy, and focus and drive. These are the main things where you can see something like testosterone really come in and remedy those problems and optimize you. So when considering testosterone replacement therapy, the first thing that you want to do if you're experiencing anything we just talked about is get a blood test. Just get a blood draw, look at three primary things. Look at your testosterone total, look at your free testosterone, and then look at your estradiol, which is the active form of estrogen in males. Now, those levels are going to tell you exactly where you lie, and specifically where you lie in respect to estrogen and the ratio of testosterone to estrogen. Now, depending on the lab that you use, the interesting thing you might notice about testosterone levels is what's considered to be normal spans an incredible range. For example, some laboratories cite a normal testosterone level as being anywhere from 200 to 1,000. which means if my testosterone is 234 and your testosterone is 968, both of our general practice doctors would tell us we're completely normal. Obviously, that's not the case. That's almost a 5x difference in testosterone levels where you may be considered normal. So first and foremost, understand the point of this discussion and the point of our goals with our clients and in general for you is to optimize your testosterone, not to have it normal, whatever that means, but to optimize your testosterone levels. Let's say you get the blood test drawn and you notice your testosterone level is low and you're interested in optimizing that level. What do? Well, testosterone replacement comes in primarily 3 individual forms. Form number 1 is a cream. Now, a cream is exactly what it sounds like. It's literally like a cream that you can get from a physician as a prescription. Now, the pros and cons of the cream are as follows. The pros of the creams include it's inexpensive. It's a mild change. So you're not going to notice a massive improvement in your testosterone. You're not going to get to truly optimized levels. You're just going to notice a little bit of a bump. If you have a little bit of apprehension about it, this might be a way to start. Just see how you feel about it and kind of go from there. And it's bioidentical, which means the form of the cream, the testosterone in the creams, is identical to what your body sees. So there's no synthetic component. So it won't necessarily raise any sort of alarms in your intrinsic system. The cons of testosterone creams, in my opinion, are significant. And those include the practical consideration, guys, that you need to get up every single day and rub this kind of oil-based cream on your body somewhere until it's completely rubbed in, and then make sure you wash your hands completely because you don't want topical testosterone hanging out on your hands. Every single day, you're going to add at least 20 minutes to your daily routine to do that. And don't miss a day because then your levels will pretty quickly begin to plummet. Con number 2, it's a topical-based cream. So let's say you're rubbing it on your leg, for example, and you're intimate with your partner. That topical-based testosterone can transfer to your partner. So your partner may begin to notice a focal area, a local area where he or she, or whatever you're into, but she may begin to grow hair in that particular region. So obviously very off-putting for your partner. Con number 3, you never really achieve optimized levels of testosterone with the cream. Like I said earlier, you can bump up a little bit, bump up a few hundred points, maybe a little bit more, but you'll never really get to those optimized levels, which leads me to con number 4, which is even when you do get that bump, you're looking at a 4 to 6 week period before that change begins to occur. So rub the cream on for 20 minutes every single day. Don't miss a day. Make sure you're very cautious of that area when you're intimate with your partner. And hey, in 6 weeks, maybe you'll get a bump that's satisfactory. There you go. That's the cream for you. So method number 2 for testosterone replacement therapy is injections. Now, injection therapy is arguably the most commonly used method. It is easily accessible, relatively speaking, very easy to obtain as well from a prescription, relatively inexpensive and affordable. So let's go through the pros and the cons of injectable testosterone. Typically, injectable testosterone is injected subcutaneously or intramuscularly in the thigh usually, or in the buttock region. Now, the pros of injectable testosterone include it's a much quicker onset than something like a cream would be. So when you inject it, it gets absorbed very quickly, very efficiently. So you should see an improvement in blood levels within a few days, if not 1 week. Another pro of it is it's relatively inexpensive and relatively accessible. Some of the cons of injectable testosterone include it is not bioidentical. It is indeed a synthetic molecule. So typically the testosterone has an additional molecule attached to it, like cypionate or propionate or something of that nature. Now, just one thing to keep in mind with this is your body will see this as a synthetic molecule floating around in your bloodstream. So sometimes that may lead to adverse events, allergic type reactions, or something of that nature. Not necessarily very common, but it is not bioidentical, and it is something to keep in mind. Another potential con is when you inject testosterone, you get an immediate release of that medication in your bloodstream. So you may feel the effects relatively soon, but you also get a pretty quick drop off. So you begin to see peaks and troughs of the testosterone upon injection. So if you're injecting once a week, for example, on day 1 of the injection, you may feel great, but on day 6 or day 7, you may feel as though your testosterone is depleted, and obviously you need to re-inject. Another practical consideration, some people have a needle phobia or just find it very kind of impractical or messy to carry their testosterone around and their needles and their syringes to inject it at work or during travel or whatever the case may be. Those are the major cons with injectable testosterone. And then finally, the final method is pellets. So testosterone also comes in a form called called a pellet. This essentially looks like a rice grain that is inserted underneath the skin into the subcutaneous tissue as a small 5-minute procedure in a doctor's office. The pros of the pellet are, number one, it is bioidentical, just like the creams are. So you have all those associated benefits. Number two, it's a long-acting delivery system. So it's almost like a pump that delivers a regular dose of the medication for the duration of the pellet insertion, which typically is about 3 to 4 months, which means, practically speaking, you may need to go see your doctor 3 to 4 times a year to get the pellets reinserted, and that's it. You don't have to worry about applying a cream every day. You don't have to worry about injecting once a week. Nothing. You go in to see your doctor 3 to 4 times a year and you're totally done. You're totally on autopilot, which is amazing. Now, some of the cons of the pellets. You do have to go in to see a doctor to get it implanted or inserted, like I said, 3 to 4 times a year, which may be looked at as a con potentially. It is arguably expensive. It's more expensive than the other two methods, if that's something to consider as well. And number three, only certain doctors do this. You do have to get specifically trained to do this procedure and kind of certified and written off that you're capable and competent to do so. Outside of that, those are really the major cons of the procedure. And then, of course, just keep in mind always, guys, testosterone cannot be taken orally as a pill or a liquid or anything like that. It's incredibly taxing on your liver if you take it that way. So never, ever, ever take testosterone orally. That is not the way to take it. So to summarize the delivery methods, you have creams, you have injections, and you have pellets. All right. So guys, that concludes part one of our testosterone conversation. In part two, the next video to drop, we're going to discuss risks associated with testosterone therapy, what risks are real, what risks are more manufactured. We're also going to discuss other medications or substances you might be ingesting can artificially decrease your testosterone, as well as other options for artificially increasing your testosterone levels as well. And then we're going to bring it all together to practically dilute everything for you. So guys, if this was helpful, please like or subscribe and share this video or this podcast. This will teach the algorithms to expose this information to other like-minded people. And as always, we always like to talk about routines and rituals and maintaining resilience to become robust. So routines and rituals with today's conversation really apply to the method of testosterone you choose to take. Obviously, maintaining the routine of taking that injection or applying that cream or scheduling the pellets is going to maintain your levels on a regular basis as much as possible. Rituals we'll get into more in the next video, really address more of things you should and should not do to artificially affect your testosterone levels positively. And of course, we're maintaining resilience. Resilience is maintaining strength in the face of difficult situations. Anything that can optimize you and optimize your hormonal balance, like testosterone, among other hormones, which we'll discuss, is obviously going to place you in a place where when life stressors begin to impact you physiologically, psychologically, emotionally, mentally, whatever the case may be, you're going to have the tools already in place to face those challenges with a clear mind, maintaining your path, maintaining focus, minimizing distractions, and pushing forward. All of these things together, proper supplementation to optimize your testosterone, testosterone replacement therapy if indicated, protecting yourself from any potential negative effects, and eliminating any other substances that may artificially decrease your testosterone. All of these together are going to optimize you to maintain a very robust state, to maintain yourself as the optimized man, to continue optimized and optimal manhood. So thank you for watching. Go ahead and like, subscribe, and share, and tune in to the next video, which we're going to break testosterone down even further in part 2.